Hello, Don here. Welcome to Podiatry Practice Mastery, where we're helping you take your practice to the $2 million mark and beyond. So I'm going to share a little bit of the backstory of starting to use Lipizzaner. This is a new treatment, new for me, probably not new for some of you that are listening. Some people may be already doing it, but it's kind of new to me. I recently was exposed to it. I previously had heard about Leneva, or I think it's Leneva. It was Leneva. And I got a sample. I never really did it. I heard there was some pros and cons about it. But Lipizzaner is another one that's out there as kind of as a fat pad replacement. And I have a number of patients that have really painful kind of calluses with fat pad atrophy. And I needed a solution. So usually for those, I try different types of like gel metatarsal pads. I'll try an orthotic with a metatarsal pad. I'll try things like that. They don't always work. And this was kind of another offer for it. So I heard about it at a recent AAPPM conference. I saw one of the reps. One of our reps now is helping us with it. And the way I learned about it is they have some online resources with like a video kind of teaching how to do it. But it was pretty easy. So I did my first one today. We used I usually drop with an 18 gauge needle. So I had the Lipizzaner, I had like a consent form, and I had the post-op instructions that I gave to the patient, had them fill out the consent. In our office, we had them give a $500 deposit for doing it, only because it's expensive, and if it gets messed up, we didn't want to get stuck with that amount. So we did a $500 deposit. When they decided they wanted to do the procedure, we ordered it. We have a little fridge that we have in one of our offices where we put it in, and we kind of keep it there. Actually, in a little freezer in one of our offices. And we got it. It came in. We have two of them. I have a couple of them scheduled. And this first patient, she was actually a 90-year-old female, had a really painful first metatarsal head on the right side, and really no fat there. I see her for a callus, but it still is painful. So what we did today, and just so you know, in terms of marketing, I also did a little YouTube video of it. I always like to do new things and so I can put a video on our website kind of explaining how I chose this patient, kind of who would be an ideal candidate for this, and then the actual procedure. I had one of my staff record it. Just as a reminder, I do that usually with CapCut. So with CapCut, you could start and stop, and you can also flip the camera to show yourself talking or show the actual patient when you're recording it. So that's the way I do it. And then I upload it to a Google Drive, and then my virtual assistants, they put in the subtitles and they put it on YouTube, just so you know kind of the workflow. But anyway, when I saw this patient, we did the consent. I did a V-block proximal to the first metatarsal head, and then I took out the Lipizzaner, and it comes frozen. There's some paperwork you have to fill out, just like when we do like an amnio injection, anything that is from the tissue bank. And I warmed it up in my hands for 2 or 3 minutes. It thawed out. I drew it up with an 18 gauge needle, and then I used an 18 gauge needle to inject it. They say you're supposed to use a 20. I can see why, because the 18 came out kind of fast, and I think a 20 you could be a little bit more precise. So what I did, and what the instructions say, is let's say you have the first metatarsal at the proximal aspect of it in the center. I pushed in the epidermis region and making kind of like a lifting up the skin in that area all throughout where I wanted to place it, kind of putting the needle in, pulling it out, putting it in, pulling it out. And then what I did is I injected the Lipizzaner as I retrograded out, as I pulled out of the skin. So I started at the most distal point and injected as I came out, moved it over a little bit laterally, and did another roll, until it was totally filled in there. Then I took it out, and I put a steri strip where that puncture was with the 18 gauge needle, kind of not dissimilar to what we would do for like a flexor tenotomy. And then I put a whole bunch of padding kind of around it to offload it, and then a gauze on top of it, some cling and Coban, and put them in a surgical shoe. They're going to wear that according to the instructions. So usually it's 3 days heel weight bearing only, then weight bearing in the surgical shoe for 2 weeks, and then transitioning back to a normal shoe, and then avoiding barefoot walking. It did feel like there was fat underneath there. It was pretty amazing how it was cushionier afterwards. The one concern I had, just as a novice doing this, is what about there was some bleeding? Like, what do you do about the bleeding? I don't think the bleeding is going to affect it, but there was some bleeding, and when I pulled out the needle, there was a little bit of bleeding there. So I don't think it affected anything. I was thinking, do you do maybe light it with epinephrine, but I did not do that. I just did regular, my same mixture I would use for a toe block. But everything went well. I did the video, so the video will be on my website hopefully soon. We did do a couple of email posts to our patients in our emails that we send out to our list, and I will let you know how it goes. How are we selling it, or what price point? We're doing it for $1,500, and it's 1.5 cc's. In some patients, they might need a couple of them, but this patient only needed one, and I can really see it's pretty much one per metatarsal head. If you have to do multiple metatarsal heads, I think you're going to have to do multiple injections. It's a smaller amount, which is probably good for podiatry, and I'm excited that I think it'll have some good use. So once again, if you have any questions, you can shoot them to me at don@podiatrypracticemastery.com. I'd be happy to help if I can give you some answers if you have any.